What's up, everybody? It's Dr. Michael Mash with Barbell Rehab. Today we're going to talk about how to really squat with tight ankles. But before we get started, make sure to like this video and subscribe to this channel. That helps get our message out as far and wide as possible. So today, as mentioned, we're going to talk about really what to do if you have tight ankles and you also are trying to squat. So the first question I have is, why do you have stiff ankles? A lot of people just have stiff ankles, and when we talk about ankle range of motion required for squatting, we're specifically talking about ankle dorsiflexion, or the ability to pull your foot upwards. And ankle dorsiflexion effectively is what allows those knees to come forward during the squat. So if you have limited ankle dorsiflexion, you want to ask why, right? Is it something you were born with? You just have limited ankle dorsiflexion, or did you have some sort of injury or surgery and never really restored that ankle dorsiflexion? And have you tried on improving it? Have you been to a physiotherapist? Have you been to a rehab specialist to formally rehab that past injury? Or have you tried your own mobility drills to try and restore it? If the answer is yes, and you've tried restoring your ankle dorsiflexion mobility and without success, then listen up, because I'm going to show you 3 actionable steps you can take in this video to sort of work around your ankle dorsiflexion limitation. So what can limited ankle dorsiflexion during the squat cause? It can cause a few different things. First, specifically for variations that require an upright torso, like the overhead squat or the front squat or the high bar squat, that relatively vertical torso is accomplished by allowing the knees to go forward. And the knees going forward requires sufficient ankle dorsiflexion range of motion. So if you don't have the ankle dorsiflexion range of motion, and you're doing a variation that requires the knees to get forward, that requires the vertical torso, and you don't have the ankle dorsiflexion, it's going to throw off the whole lift, and it's going to cause you to pitch forward. And the last thing you want to do on an overhead squat or a front squat is to pitch forward. So that's one issue it can cause. Another issue is a hip shift. So hip shift during a squat is when you sink down into the squat and then you shift your hips one way or the other. If you have a significant ankle dorsiflexion limitation on one side, you may find yourself shifting to the opposite side, or shifting to the side where you have adequate ankle dorsiflexion range of motion. If you want to learn more about how to really fix hip shifts during squats, we have a comprehensive article that I'll put in the link in the description. So the other thing it can cause is actual ankle pain, or that dreaded pinchy feeling right in the front of the ankle, anterior ankle pain. And if that's the case, and you've already tried working on restoring mobility without success, you're going to need to make some modifications. So here are 3 modifications you can make if you have limited ankle dorsiflexion or tight ankles during the squat. Number 1, use a heeled lifting shoe. When you squat with a heel 3/4 inch up to an inch, that starts your foot or your ankle in a position of plantar flexion, so you don't need to go into as much ankle dorsiflexion to get the knees forward. So if you have limited ankle dorsiflexion and you're dumping forward on the front squat or the overhead squat, simply putting on a heeled lifting shoe can change everything. It'll allow those knees to go forward. It'll allow you to get that upright torso. So putting on a shoe is not a crutch, especially for people who have already tried mobility work for the ankle unsuccessfully. So number 1, try a shoe. Number 2, you can simply turn your toes out more. By turning the toes out, getting the knees out, abducting or abducting the hips, this is going to decrease the ankle dorsiflexion demands of the squat. So if you have limited ankle dorsiflexion, put on a heeled lifting shoe, turn your toes out, and that will all help to reduce the ankle dorsiflexion demands of the squat. In step 3, you can also try low bar squatting. So if you're not really married to one squat variation and you just want to train the squat for general strength, if you have limited ankle dorsiflexion range of motion, switching to a low bar squat, a variation where the barbell is carried a little bit lower on the back on a muscular shelf created by the rear deltoids, this squat variation actually encourages forward torso lean and limits forward knee migration, so it doesn't require much ankle dorsiflexion at all to successfully complete. So try low bar squat. So if you have limited ankle dorsiflexion during the squat, again, try wearing a heeled lifting shoe, try the low bar squat, and turn your toes out. That will all help work around that ankle dorsiflexion limitation so you can continue to squat in a tolerable fashion. And as mentioned, if you like this video, guys, please subscribe to this channel. That helps us get our message out to as many people as possible. And thanks for watching.